We established the Ticket Home project based on a pilot we conducted in 2022. And the pilot highlighted that there was a need for people to be supported with social issues to enable them to be discharged from hospital when medically fit. So we're collaborating across West Essex with a range of partners, and the strength of this project is really partnership based. We're working with primary care network teams, we're working with social prescribers, but really what the strength of this is the network of voluntary organisations that we are working with. That really enables us to deploy a lot of resources. So the project can really support people to return home by overcoming the issues that block them returning. And they are social issues such as the inability to move their bed from upstairs downstairs, to have a key safe installed, to have their home cleaned before returning, and for the provision of hot meals and other services like that.
I became involved with the Ticket Home scheme because it's one of the requirements of my service. As you know, for us to be able to discharge patients, it is not always healthcare. It is healthcare, physical healthcare, at the same time social care. And Ticket Home actually delivers that completely as in a holistic approach. A lot of our patients needed support more than physical needs, but actually a lot of support preventing loneliness, isolation, and social care in the community. The Ticket Home initiative works really well for us, because it is well integrated to the older persons assessment and liaison service. They are part of the multi-professional team that delivers holistic care for our patients. Selection is a lot more easier because all we need to think about is where do the patient live, and obviously they live in Essex, and where is the GP surgery. If they are all in Essex, then we send the referral across.
Yeah, it's the news you've been waiting for when you've been in hospital for whatever reason. So to get that news that you're actually going home is the best thing ever.
The Ticket Home service makes a massive improvement on the patient's recovery, and at the same time is avoiding unnecessary readmissions to hospital. Because one, it reassures the patients and the family that they are wrapped around in the community to allow them to thrive, improving their general health and well-being, not just the medical needs.
The care package was on a sort of waiting list for last week. So she's almost spent another week in here unnecessarily. But now the UCAN discharge team has said that we can actually go home. It's a lot better for everyone. So she's a very happy girl.
I am.
I think it's a brilliant idea for patients. It enables their prompt discharge. They don't have to wait, and they can get home and have the support following their discharge. My role in supporting this initiative is to enable their discharge, but also support them once they've been discharged by follow-up calls to identify any further support services they may need. The way we support patients once they've got home is we do a 48-hour post-discharge call, and then subsequently on weekly calls to identify any further support services they may need, and we therefore then make those referrals once identified. My message to patients and families is, if you need support to enable your loved ones to get home quickly, take the Ticket Home discharge initiative forward.
Ticket Home initiative has been great for primary care because what it means is that patients can get home quickly and safely, and for primary care it means that we know that the patient's needs are going to be met. So if there are things which need to be done, for example changes in medication, hot meals, or if patients just need a welfare call a few days after being home, we know that all of those have been organised for the patient.
I stayed at least 4 weeks in the hospital, and I was in there for pneumonia originally, but unfortunately caught COVID. I stayed at least 4 weeks in hospital, and I've been home roughly 3 weeks since I've been in my own house. I was nervous about coming home as I didn't really know what help was available for me. I had no idea, as I've not been in hospital for many years. I think the idea is absolutely fantastic for people that live on their own, and it gives them confidence to be able to get on and do bits and pieces for themselves instead of having to rely on other people. Ticket Home was a great help because you had then somebody coming in with your food, your meals, which was, well, fantastic help. And also my prescriptions was delivered to the door, which enabled me to have peace of mind. The Ticket Home team gave me the courage to get on with my life, and without them I don't quite know what I would have done, because you aren't well enough to cook your own meals, and if you haven't got anybody close at hand, which I hadn't, I wouldn't have been able to have coped.
So the project to date, we feel, has been really successful. We've had over 115 referrals. All of those people have been supported in their discharge, and the feedback from the patients has been really positive, but most importantly from their carers and family members. They really have felt supported. So at this stage, we're really pleased with the way the project's developed and evolved. So the impact on the staff at the hospital, especially the discharge team, who we work very closely with on a daily basis, has really been powerful in that we're working with the low to moderate patients, and that has taken a load off that team so they can focus on the more complex patients. And so our joint efforts have really made a difference.